So a hernia is a defect in your muscular wall that allows passage for the contents from inside your abdomen to protrude through that defect. You can get these defects from congenital defects. The most common area for this is actually in the inguinal region, which is down in the groin. And this is a defect that allows passage of anatomical structures in and out of your abdominal cavity. Most people will notice their hernias first by either an uncomfortable feeling or a bulge. A lot of times you'll have a bulge with no pain associated with it, but a lot of people will have some discomfort, usually at the end of the day, that is an aching type of a feeling that causes them to really notice it more after they've been active. Okay. And that's more notably in the groin. Okay. Anytime you stress that hernia, you may also have some discomfort with that. So whether it's at the belly button or in the groin or anywhere else, if you're pushing something into it, then that can be an issue for tenderness. So there's different ways to fix it. Usually we will fix these with mesh, and we like to place the mesh, if we can, under the muscle wall. In the groin, there's two commonly used methods. One is an open, or what we call the Lichtenstein method. And this method of repair opens the inguinal canal by making an incision over the top of the inguinal canal. And so we go down, open the canal up, isolate the spermatic cord, and we place a piece of mesh on the floor of the inguinal canal so that we can reinforce that hole. So the other way to do this is laparoscopic. There's two different laparoscopic methods. The one that I use is called the total extraperitoneal method. And that is a method where we make an incision next to your belly button, and we come down underneath the rectus muscle and put a balloon between the abdominal wall and the abdominal cavity. And once the balloon is inserted into the space, it's inflated, and we dissect this space so that it allows us to have room to work. And then we isolate the spermatic cord again, and this time we're on the other side of the abdominal wall. And we find the hernia sac, and we pull it back out of the hernia itself, and we cover the hernia with mesh. And this time the mesh, instead of being on the floor, is behind the muscle wall, so it's reinforcing from behind. There is actually a difference in recovery between the open procedure and the laparoscopic procedure. Generally for laparoscopic procedures, you are able to start full activities in about 1 week following surgery, whereas for an open procedure, that time limit is at 6 weeks. Generally for hernias, I recommend that they all be fixed. The earlier that we can get them fixed, the easier they are to fix. And if it's easier for me to fix it, that means it's easier for you to recover. Sometimes if there's a really small belly button hernia, I will just kind of watch that if it's not giving any problems. Okay. But for most hernias, I do recommend that they are fixed sooner rather than later.
For more information about this physician or to schedule an appointment, please call our referral line or visit notbiggerjustbetterhealth.com.